The pandemic has elevated health data and its uses beyond imagining, with governments around the world looking to track and trace what is happening in their own backyards. Here in the UAE, the response to the pandemic has been hailed as world leading. And one of the pillars of that success has been health data and technology and how they have been used here to fight the pandemic. But it's a field that promises much improvement in healthcare systems far beyond the pandemic. So today, I'm delighted to be joined by Atif Albraiki, the CEO of Abu Dhabi Health Data Services, to unpack what this means. Atif, welcome to AB Talks.
Thank you. Thanks, Scott.
So this is a massive area which has become all-encompassing for governments around the world. I think probably just give our viewers an overview of the work you do at Malafi. How do you help exchange information and what are the benefits of that?
To really understand Malafi, we just need to go back maybe around 15 years ago. Yeah. Abu Dhabi around 2004 went through a major healthcare reform where insurance or health insurance was introduced. It was a mandatory universal participation. What the government also then did is established a company called Sahha to manage and run all the government-owned healthcare facilities. And they encouraged the private sector to play a bigger role in providing care. So that's where like the likes of Mediclinic, VPS, Cleveland Clinic, started providing care and really give patients more access to care. And that played a key role in terms of enhancing the quality of care in Abu Dhabi. But then it created also more fragmentation, because it's the same patient who was moving across all those facilities. All the government facilities in Sahha were connected through one unified medical record, through one electronic medical record system. But the challenge then was, the same patient moves to the private. These systems are not interlinked. It created a lot of care coordination challenges. It also resulted in overutilization of unnecessary repetition of tests. So maybe around 4 years ago, the idea of establishing a platform that will facilitate the exchange of health information across the Emirate came into the discussions with the Department of Health, which is today regulating the healthcare sector in Abu Dhabi.
Yeah.
And in 2017, we started working on defining a business case for building such a platform, looking at, how can this platform be operated? What's the best technology architecture that should be put in place? What's the business model? How are different stakeholders are going to benefit from such platform? And what we did, basically, we built a central clinical data repository that connects with all the electronic medical record systems across all the facilities in Abu Dhabi. For every resident, regardless of where that patient moves across the healthcare facilities, all his or her data is going to be available in this central clinical data repository. And then we give easy access to the healthcare providers to query and to look at the previous medical record of that patient whenever that visit happens.
That seems like a daunting task. It seems like a massive task. How on earth have you approached that project to take all that? I mean, how many people are we talking about? We're talking a significant number of records there. How on earth have you done that?
Yeah, so we're talking about around 2,000 healthcare facilities, for a population of around 3 million.
Yeah.
Really, it starts with proper planning at the beginning. So we spent a lot of time, to be honest, putting a business case and plan and discuss with the different stakeholders, engaging, being it the healthcare providers in the Emirates. The regulator played a key role in terms of putting a very clear policy with a timeline that provides the sense of urgency, in terms of connecting to Malafi. So they did not leave just an open timeline. There were deadlines, put in place by the regulator. So that creates the sense of urgency for everyone to connect. And then really the pandemic showed the value of this platform. And really it made the program accelerate. And for the different stakeholders, being it the healthcare providers, the public health department, the different stakeholders in the healthcare sector, to really see the value and really to get engaged more in terms of ensuring that we deliver this platform fast, we start seeing the value and the outcomes of such platform.
Well, I mean, to me, it makes sense when you look at coronavirus and what happened in 2020. But what have been those value, that value that you've seen? both in terms of the patient perhaps experience accessing a healthcare system and those providers who have now signed up and joined in the Malafi project?
Yeah, so the government in the UAE and in Abu Dhabi, they decided to go with the strategy of maximizing the number of tests that is happening for the population. Yeah. So with that mass amount of PCR tests that were happening, that created also reporting challenges, right, to the Department of Health or the Public Health Department, and also it created challenges in terms of monitoring the spread of the disease. Mm-hmm. So if we depend on manual reporting, which was the process, before having a system like Malaffi, it was creating a lot of overhead for the different stakeholders, being it the providers who have to report, or even the public health department who need to, receive those reports and then do the contact tracing and looking at the spread of the disease. Malaffi helped in playing a role in automating this process. It was challenging. I mean, in the early months of the pandemic, getting all the labs connected was a challenging experience. The labs had different competing priorities. Then on top of that, they had to connect, their lab information systems to Malaffi. So it was challenging for the different stakeholders. But then what it really played a role in is that once we connected all these labs, we were able to get insights about the spread of the diseases, the infectious rate across the community. And that then played a key role in terms of early prevention measures that were being taken to contain the spread of the disease across the different areas. It played a key role in enhancing the coordination and the communication between the different stakeholders in managing the pandemic. At later stage, when when antibody tests and vaccination programs started, we were able to link the PCR tests with people who are getting vaccinated, and then link them with also the medical record of the patient, and to really provide different insights for the public health department, who were really playing a key role in coordinating the efforts of everyone in the healthcare sector. So that was the real value of having such a platform.
I mean, I can't imagine how you could have tackled that with an old-fashioned manual system. I mean, was it was just good foresight and planning that as this pandemic came, you had this foundation of a system that you could actually turn on and attract people into?
Yeah, I think, to be honest, we were lucky by having the foundation. And so we were able to really utilize this asset to play a key role in the pandemic response. The manual reporting is a great system. We're not saying so, but to manage such a pandemic, having a manual surveillance is going to create a lot of challenges.
Yeah. Now, within all of that, I mean, AI is prevalent in all of our lives. How have you integrated artificial intelligence into this process? Because I imagine this isn't just people tapping on computers all the time. There's programming and algorithms at work here as well.
Yeah. So that was also something that we planned on from the beginning, because a health information exchange has what we can say, different options or different architecture design that you can deploy. So we selected an architecture design that will enable us to do predictive analytics in the future and to be able to get insights from the data that we have. So in 2020, one of the key projects that we adopted was to collect 2 years of historical medical record of patients, put it into a machine learning algorithm that can then predict the potential diseases or people who are at high risk across the population for the next 12 months.
Wow.
So we did a proof of concept last year to take specific segment of the population, apply machine learning to 2 years of their historical data record, and to then look at the potential risk of certain population of specific diseases. And this year we're working with the non-communicable department at the Department of Health to really operationalize the insights that we're getting from these from those insights in terms of doing more population health programs, coordinating care for people who are at high risk of certain conditions. And that's really the power of having such a platform. When you are able to collect such mass data of medical records, you can always apply AI and machine learning to really drive insights that can predict the future, so that you can plan better and do more proactive and preventative programs.
So if I'm in Abu Dhabi, your algorithms are going to be looking at my medical records and going, Scott, you need to lose weight, you need to do some exercise, otherwise you're at risk of A, B, C, D conditions.
So we give high-level population health insights to the Department of Health. At this stage, we don't provide insights directly to the patient.
I need them.
Yeah, I mean, it's because we still don't have a patient portal or a channel that's going to provide that level of access to the patient. That's something that's being studied to be implemented in the future.
Yeah.
But at this stage, we're providing it for the public health department.
Can prioritize where it.
Exactly, and then we're going to be providing specific insights for the care providers within our clinical portal. To give them insights about the potential high-risk patients, so that can be a key aspect when they're providing care and something that can help them in their decision support.
You were talking earlier there about the business case. Just talk to me a little bit, because you had a little bit of, not opposition, but you had different players with different systems and different priorities, and you've managed to harmonize that, and perhaps coronavirus has been the thing that has accelerated that cooperation. Now that you're there, what is the business case for the providers? Well, how does this make their lives better? How does it improve revenue? Does it improve operational efficiency? And also, what's the benefit for the patients? The ultimate end user, the ultimate customer.
Yeah. So, for the providers, such a platform, it enhances their operational efficiency. Usually when you, as a caregiver, when you see a patient, you have limited time.
Yeah.
The more summarized information you can get, it can help you in providing the right level of diagnosis and decision, in providing care to that patient. So what we do in Malafi is that we consolidate that information. So instead of depending on asking the patient, we can give you a quick summary, a snapshot of that patient, which will then make their, hospital operations much more smoother. It also helps in providing a better experience for the patient, which then, increases the patient satisfaction with that facility, which then, potentially then play a role in also, in improving their business operations. So these aspects are really playing a key role for enhancing the operations of the providers. At the end, also all the stakeholders, being it if it's the healthcare providers, if it's the payer, we're all serving the patient at the end. So anything that can help in providing a better patient experience, it definitely going to be benefiting the stakeholders indirectly.
So thousands of healthcare providers, 3 million people, a journey that started years ago. Where are you at right now then? Everyone's connected, every record's connected. Where are you at in your journey, and where do you go next?
Yeah, so we have more than 1,400 healthcare facilities already connected. That gives us a market share of around 97% of the market episodes. All the hospitals are already connected.
Right.
The big clinics and centers and the medium size. Now there are still small clinics and centers that are in the process of completing their technical requirements to get connected with us.
Yeah.
And few pharmacies in Abu Dhabi are also completing the technical readiness for them to connect to Malafi.
So 2020 was a learning curve for nearly every sector and every industry. What would you say were the biggest things you learned as an organization in 2020? And were there things that paths it forced you down where you actually think, actually, that made us better?
Yeah, so one of the key aspects is planning. When you have a solid plan, it helps you whenever you need to execute. So having the foundation that we built based on a proper plan, it really paid off when the pandemic started. Another key aspect is collaboration. We had all the stakeholders engaged from the beginning, and that stakeholder management and engagement, it enabled us to collaborate better, to work together, and understanding our competing priorities, but then to be able to fulfill the needs of the sector. So those were like key lessons learned from us, in terms of early stakeholder management. And such a big platform, when you're coordinating with different stakeholders, engaging them, managing that change management plays a key role in ensuring that you have a smooth execution, and then you start seeing the outcomes, of such a platform.
You talked there about public and private sector collaboration. I mean, I've seen outside commentators say that the collaboration in the UAE between the private and the public sector has been unprecedented, and that's been one of the secrets of their success while dealing with with coronavirus. How important has that been? And how proud of proud are you of both Malafi's role in that, but also how the public and private sector both stepped up to work together?
I mean, that was extremely important. Malaffi, if it wasn't for all the stakeholders really collaborating with us, and they had competing priorities, all healthcare providers, they had so many other demands, but they were always playing a key role with, supporting the initiative. And that comes from their understanding of the importance of having such a platform, seeing really the value of data sharing. And this pandemic really showed that, we are stronger together, in any response to any pandemic. So all the healthcare sector, working together, understanding our own, priorities, played a key role. And, I recall, for example, that urgency that we were getting from the Department of Health. We were going to facilities that had various competing priorities in terms of, setting up new testing facilities, ramping up their resources, managing their ER departments. Yet, they had to also meet Malaffi requirements, working with our teams late at night to make sure that we meet that requirements. That was key for us, for managing this pandemic.
97% connected. So within that, what's the kind of breakdown? Who is connected to you now then? So how many hospitals, how many clinics? How's that breakdown look like?
So hospitals in Abu Dhabi, all of them are connected. 100%. Every single hospital in Abu Dhabi is already connected to Malaffi. And then the big clinic and centers, all of them are connected. We're talking about the small clinics and centers.
Yeah.
We're talking about maybe around 100 or 110 clinic and centers that are still not connected, due to interoperability challenges with their current system. So they're working on completing that integration requirements, and we're hoping to have them onboarded very, very soon. And we're talking about maybe around 450 or 500 other pharmacies, the standalone pharmacies that are completing their integration requirements.
So that must be tremendously reassuring for patients when they go into hospitals, and also must be incredibly useful for the staff working in those hospitals that whatever hospital they go to in Abu Dhabi, they're connected to your network.
Definitely. Yeah, so for us, we are looking at what additional data points that we can capture to provide better insights for the healthcare providers. One of the key aspects are images. So today we're exchanging radiology reports, but many of the users have said, okay, can we exchange images so that I can pull the CT scan or the X-ray that was done for that patient. So that will be one of the key priorities. The other aspect is driving better insights from the data that we have and providing more actionable insights to the public health department, who then can better serve the healthcare sector in Abu Dhabi. And at the same time to also provide insights and actionable insights to the care givers. So today we're giving them that unified medical record in an easy to navigate way, but can we also provide them predictive insights that can help them in their support for that patient. So these are the key priorities for us, capturing additional data points and additional value. And then in terms of using AI and data analytics to provide more actionable insights for the different stakeholders.
So I'm going to repeat something I read the other day, which sounded clever, and I'm going to ask you how much you agree with this. Someone was talking about healthcare and healthcare tech, and they said that data now is as important as the surgeon's knife. Would you agree with that statement?
I totally agree, because at the end, understanding the current and the previous condition of that patient is a key aspect in providing the right decision and the right care. Today, data is easily available, but if it's not presented in an easy way for the healthcare provider, to understand it and really to action on it very, very quickly, that data becomes useless. So having, an HIE or having robust electronic medical record system, it can really play a key role instead of, going and looking through papers or, notes. Having data structured in a system is really key in terms of providing, actionable information that the caregiver can provide the right level of diagnosis and support for that patient.
Atif, genuinely pleasure talking to you on AB Talks today.
Same here. Thanks a lot, Scott. Thank you.